All right. Well, thank you so much for that introduction, Jennifer. And I want to thank Deb and Becky and everybody at Senior Community Services for having me join you here today. I was telling Deb on the way in, I've been so impressed with your board of directors and just how engaged they are and your staff. And I think that really speaks to the leadership and the team that you've got assembled here. So I'm just so impressed with everybody and really grateful for the chance to share with you today. So as Jennifer mentioned, my name's Stephanie Devitt, so I'm the founder of SDK, and so we work with state and local governments, foundations, providers, et cetera, to help them understand the communities that they serve and how policies are impacting people in a daily life, and then try to translate that into really great plans and actions that can be helpful for communities. And so I'm going to give just a little bit more background on what Jennifer had alluded to in terms of some of the work that we've been doing over the past few years. So I think everybody remembers the pandemic as being a time of great change for everybody, but especially those who might face inequities in their daily life even before the pandemic. So our BIPOC communities were impacted by the pandemic in unique ways that we really needed to understand and support if we're going to create our equitable communities. Seniors, unhoused, were also impacted, people leaving the correction system. And so across a variety of projects, not just those that Jennifer mentioned, but several others in areas of transportation, digital equity, telehealth, safety, we had an opportunity over the course of our work to speak with really about 2,000 people, and most of that is in-depth interviews, so you're spending 30, 45 minutes trying to understand someone's experience. And through that, about 90% of the people that we spoke with over the course of these past few years were from the communities that I mentioned. So people from BIPOC communities such as African American, immigrant communities, Native American or others. Also spent time with older adults, understanding their experiences and even inequities in aging, unhoused, et cetera. And also talked a lot with providers who are supporting those communities over these past few years. So we talked with healthcare providers, we talked with FQHCs, behavioral health centers, also community-based businesses and support services, whether that's social services in your county or your chamber of commerce, et cetera. And what we were doing across all of these projects, when you think about it kind of at a big picture, is we were trying to understand how are people connecting to resources and opportunity now? I think everybody remembers that when we were in the spirit of the pandemic, in addition to just the nature of COVID, because of sheltering in place, we were changing how we were getting to and connecting with each other for relationships, for work, for healthcare. And we were also thinking about how are people using public spaces, or how are they coming together in person? When does it make sense to come together in person? And so what I'm going to share with you today is a composite of some of the themes of what we heard in doing some of this investigation, specifically as it relates to what we were hearing from older adults and the caregivers who support them. But before I get into what we learned in that process, I wanted to give just a little bit of policy context. As I was talking with Deb and others at Senior Community Services, we were talking about the fact that some of the law changes that have really created this boom in telehealth that we all see right now and broadband that we all see right now are driven by a few policies that are actually going to potentially change again soon. It's amazing even how much has happened this week. So there are two key pandemic policy changes that really springboarded and drove a lot of this. One is telehealth expansion. So we might take telehealth almost for granted right now in terms of how much we can get care online, but that was actually a product of the COVID emergency legislation. And the other is broadband expansion. So I think we all learned when we were sheltering in place that getting online matters, and not everyone can get online equally. So in terms of just that policy context, just so we can all level set, when telehealth expanded at the start of the pandemic, this is really at the federal level, although it was mimicked at the state level. telehealth was allowed to expand in a few ways. Number one is more places. So prior to the pandemic, telehealth was not a reimbursable service in the metro area. I don't know if folks remember that. So if you were in, say you were in Medina and just didn't have a car to get to the doctor, you would be considered metro enough that telehealth was not a reimbursable option for you pre-pandemic. Another was more modes. So Congress at the time of the pandemic recognized that not everybody has online access, and they started allowing reimbursement for audio only. Good old-fashioned telephones like the ones with the cords we heard about a minute ago. Prior to the pandemic, that was not a reimbursable service. And then another piece that was allowed because of the pandemic was more services. So behavioral health services, seeing a psychologist, a counselor, anything like that over telehealth, that is a product of the pandemic. It was not allowed prior. Same with substance abuse treatment. And so the pandemic public health emergency ended last year, and we've actually been in a period since then where states and the federal government and CMS are looking at what of those expansions they're going to keep and what they're actually potentially going to do away with. So far, the only pandemic expansions of telehealth that are permanent are in the behavioral health space. So you can still do behavioral health telehealth from home, you can do it or orient from FQHCs, rural health clinics, and you can do audio-only behavioral health, and that is reimbursable at the federal level. So what I'm thinking about there is, and I'm assuming this is relevant for folks in this audience, Medicare and that reimbursement. But there are key pieces that are actually set to expire this year. And there's a pretty good chance it's going to get like a 2-year extension, but for the time being, they are set to expire at the end of the year. The big one being, right now there are no geographic restrictions on where you can do telehealth. So at the end of the year, it could be that you have to be in designated rural areas to do telehealth. Telehealth would no longer be an option in the metro area, as an example. So that is a key piece that people are watching. Also, FQHCs, rural health clinics, some of those, they're able to integrate telehealth into their business model now in a way that could potentially end at the end of the year. That is just a temporary extension they have right now. And then audio only for anything other than behavioral health could end at the end of the year. So that can be important for the older adults that you're serving who may not be as comfortable with smartphones and might want to do, say, a medication check visit over the phone, something like that. So it has real implications, and I think not everyone is always, well, it's just important to understand that these were actually temporary changes, even though they've really become woven into the fabric of how we do work. Other thing to know is broadband expansion. So broadband expansion received significant investment at the start of the pandemic, both in terms of a benefit. You could get $50 a month for your broadband subscription, and you could get $100 for a device. And then the CARES Act, if people remember that, there was a significant investment in emergency spending, and that was allowed to cover broadband. But probably the bigger broadband investment people are watching is the IIJA. So there are significant provisions in there to expand broadband access across the country. Kind of the key components of that, just so you know, one is this BEAD program. That's about putting wires in the ground. I think everyone knew our conference was this week because the amount of things related to this that have come out since Monday is kind of crazy. So literally yesterday, the federal government approved Minnesota's plan for how they're going to spend the BEAD program. So we'll get $650 million. Most of that will go to rural areas, but that's about wires in the ground. Digital equity was also included for the first time in the IIJA. So that's the first time the federal government has addressed and named digital inequities as being an issue. And they think about digital inequities in terms of covered populations, so that's BIPOC community members, unhoused, people leaving the correction systems, rural, and older adults are identified as a covered population in that. So Minnesota has a state plan. I'm just kind of brushing past this so that everyone is operating with knowing what's going on these topics. Minnesota has a state plan that's been approved, so they're going to start rolling out grants related to implementing that plan in the coming months. In addition, there is half of the money set aside is competitive grants for cities and counties and nonprofits to go after. So there was a deadline this Tuesday for the first round of those competitive national grants. So we'll hear kind of early part of the year who got those. But that's another source of opportunity that's coming up. But really all the planning on these pieces is just finishing up literally in the past weeks, and it's going to move into implementation. And then the third part of the policy that's worth noting is the Affordable Connectivity Program. So that was $30 a month automatic benefit to help with your online access. And anybody who was income qualified for any other federal program, so if you're on Medicaid, housing, food assistance, anything like that, you automatically got enrolled in ACP. That program actually ended in May. And so we're seeing some significant impacts because of that. So when you take all of these pieces together at the end of the pandemic and kind of where we're at right now, we're moving in this place where we've been investing heavily in moving things online during the pandemic. We've been investing heavily in these planning processes to figure out where that IIJA money is going to go. And now we're actually just on the precipice of this new era where it's really this question of what do we keep online? How are we going to resource that in a sustainable way? And what do people want to keep online kind of permanently versus what might roll back? So ACP is an example. Some people are trying to revive that program, but we don't know if that will be the case. So far, there have been about 10 million seniors nationwide who have lost that benefit, and that can be a big impact if you're on a fixed income like many seniors are. So with that, I want to talk to you a little bit more about just how we think about the priorities and the lessons for broadband and telehealth that came out of some of the work that we've done. And it really comes down to, I think, 3 key ideas that I'd like to leave you with today. Number 1 is that broadband access is critical to health. It's really foundational when we think about it. And I think it's something to really be cognizant of as we think about moving forward in health. Number 2, older adults are having less access to online technologies and broadband as a whole compared to the rest of the state. And so there are significant needs in the older adult community to take advantage of those opportunities. And when we think about taking advantage of those opportunities, we need to think a little bit deeper than the kind of the 3-legged stool of adoption, affordability, and access. And we're really starting to think about it in this idea of get connected, but also keeping people connected and giving them the tools to know how to use that connection. So I'll share with you a little bit about what we heard of community priorities on that front. So first, in terms of broadband being critical to accessing health. Let me watch time. Okay. So are folks here familiar with the idea of the social determinants of health? So this is a Robert Wood Johnson Foundation idea. It's been around a little more than a decade, I think, maybe even more than that. But it's this idea that the outcomes that you have in terms of your health are not just about the care that you get at the doctor. It's actually bigger than that. 10% of it's maybe the health care that you get, but it's also things like genetics in your environment. It's things like your behaviors, your choices, what you choose to eat, whether or not you have a chance to move. And probably the biggest part of the social determinants of health, that 40%, is actually social and economic factors. Do you have stable housing? Do you have access to transportation? Do you have access to resources? So in 2017, 2018, before the pandemic, Robert Wood Johnson Foundation actually started looking at broadband to say, where does this fit? How do we think about it? And the conclusion that they came up with was actually that they would consider broadband a super determinant of health. That is, across the whole social determinants of health, if you don't have broadband, you're going to have lower outcomes in all of it. You'll have lower outcomes in social access and care access, et cetera. So it is really foundational in that way. To make it more concrete in terms of an example, the Journal of American Medicine actually did a study just after the pandemic in 2021, I think, where they went back and looked at, in 2020, for morbidity from COVID-19, what social determinants of health would be most correlated to death from COVID. There was only one that was statistically significant, and it was broadband access, which I found surprising. So when we think about broadband and connecting to health, it's actually really important in a way that is probably becoming even more so as technology continues to grow in our communities. And when we ask people how they're going online, why they're going online, it goes beyond just shopping and connecting to friends and family, although if we do a survey like we did, 97% say number one thing they want to do online, talk to friends and family and go shopping, and I don't blame them. But in addition, the two most common reasons to go online after that is, number one, actually accessing services. I don't know if anyone else has gone through those portals where, like Social Security recently just asked me to sign up with a two-party authentication to like check benefits or whatever. But more and more, a lot of our services are going online. Even a lot of the counties around here are starting to offer services online, whether that's DMV or any other. And then the fourth most common reason was healthcare, people going online for healthcare. And I will say, in some of the interviews we did, I know one interview really stands out to me in my memory, where we spent a day down at Dorothy Day in St. Paul talking with folks about what does broadband mean to you, why do you need to be connected? And the thing that we heard most consistently in those conversations is how people would prioritize keeping their cell and their broadband connection over almost anything, because that's what they needed to get access to their doctors. Like if they didn't have that, they weren't going to keep their access to their doctor. They could get spit out of a system, have to go back in. The consequences were really significant, where people were prioritizing keeping that access almost over anything. And when we think about why broadband matters specifically to telehealth, and I want to give a small plug. So the Minnesota Department of Health has been doing its own study on telehealth over the past 2 years. We were grateful to be a partner in that project, and we did all of the interviews with patients and with providers, but they've also done a number of other fantastic studies on looking at electronic health records data, actuarial data, et cetera. And that report to the legislature came out on Monday, so anybody who'd like to see some of those things, find me after. I'd be happy to share it with you. But one of the things that we heard in our interviews talking with people specifically about why does telehealth matter to you, is that number one reason is it was a huge help for overcoming barriers to transportation. And that's bigger than the geography of rural areas. It's also, if you look at this bottom quote, you know, we heard from somebody who lives in Hopkins, but they need to get their care over at the VA, and it was 2.5 hours each way. So if you're doing like a medication management appointment, that's 15 minutes. What does that do to your quality of life to have to take transit that far? We heard from others who were older adults, might have some mobility issues and were relying on transit, and they weren't feeling totally safe and like navigating just all of the changes in the transit system to get to their doctor and get back, and think about how much time that was taking out of their day. So when we think about broadband and telehealth, that was an important piece that really came out consistently. Another reason that people were really emphasizing the importance of broadband and telehealth in terms of caring for older adults specifically was the way it allowed for multi-generational care. And this is completely organic and honest. I didn't know about the video they would share earlier, but that's a perfect validation of that idea. We heard from so many adults who talked about how telehealth let them help their parents navigate care in a way that they wouldn't have been able to, because they don't always live in the same town as their older adult parents now. So if you've got older adult parents that are in New Ulm and you're living in Shakopee, you no longer have to take a day off work to go down and get them, bring them up to a special doctor to do kind of a pre-visit before surgery, bring them back. You can just have the surgery where it needs to be had, but those pre and post visits, you can be part of supporting them, but do it from your home. And so we were hearing from adult children that they really appreciated telehealth as a resource that allowed them to be more involved in their parents' care if they didn't live in the same community. So that's another advantage to it. And then the third thing that we heard from people in terms of why telehealth and broadband were mattering for health is the way that broadband was allowing healthcare and other services to really integrate in a positive way. For some, this actually came down to things like senior centers, day centers where there are staffing shortages right now. And this came up more in the disability community, but we would hear from a lot of folks that where there are these staffing shortages, telehealth is allowing them to keep their staffing minimum numbers and still be connected with doctors or get members and patients to their doctors and back in an effective way without being short-staffed. Others were talking about the way they were offering these online classes and opportunities, and you would start to get more older adults supporting each other in exercise, in cooking classes, things like that, to really help them stay healthy and be connected to those services, but also potentially supporting each other from a broader geography. People from Brainerd and the Twin Cities all in the same class supporting each other. So that idea of social connection and those social aspects that support people's health were really important to where people really valued telehealth. So while telehealth is an important part of broadband is an important part of health, not all older adults have access to broadband to really take advantage of these opportunities. And I think that's just worth noting here. So when we think about broadband access, overall, this is just quick stats from the American Community Survey, but a little over 95% of of all people in the Twin Cities say that they've got broadband access of some sort. When we talk to our older adults, it's closer to 80%, but actually there's also an income component to that too. When we're talking to older adults who are at about 250% of the federal poverty line or below, 100% or below, only about 60% have online access. It's a little more than that, like 60 to 65, but there is a definite income gap in terms of who has that broadband access, even if your geography allows for the wires. And the device access is growing, but device access for older adults is still below what we see for middle-aged and younger adults. So the red, that last button actually should be 81%, but you see in red, the top is smartphones, the second one is tablets, and then same below, smartphones and tablets. Our older adults have much less device access than what we see in our middle-aged population. So when we think about getting online and using some of these services, they don't always have the devices that they need to take advantage of telehealth, to take advantage of some of those connecting services that we talked to, even though there is that value proposition there. So next, I am going to share with you a little bit more about how we're thinking about addressing some of these broadband access gaps for older adults and what that can look like. So when we think about broadband access, I mentioned this idea of cycles of opportunity. To back up and think about broadband, in the metro area here, there's virtually universal coverage of broadband access. But the reality is, like what we just saw for older adults, not everybody can get online, and that means not everybody can take advantage of those telehealth opportunities, programmatic opportunities, or others. What we found when we were digging into what is causing these digital inequities is that it's really about not just getting people connected, and there's significant challenges in getting people connected, but it's also about keeping them connected and keeping them connected at a high enough level that they can really participate in online life, and then making sure that they know how to use that connection. So when we think about getting connected in the Twin Cities, what we're thinking about is having available broadband. We're thinking about having available computers, smartphones, tablets. So do you have the device that you need to get online? But then there's also this question of, do you have enough income to afford enough data to take advantage of those opportunities? And then do you have the credit? Do you have the contracts that you need to take advantage of those services? So I think those second points are things that we don't always talk about, but are really important to getting full access to online life. So here's what we found when we identified these issues. And I'll say, even when we were doing this broadband study, I put myself on a like kind of a suppressed data cell plan and put my house on a lower data broadband plan just to see what it's like day to day. And it is significant. Like my husband and I were on text chains that I still haven't gotten the message. You know what I mean? Or like, this is a small thing, but I was actually having trouble if you go use your little bonus at Chipotle, you know, they text you something. I couldn't get the text in time, it kept timing out, which is a small detail, but I think it's illustrative of when we talk about broadband access, it's not just about the wires, it's also about making sure we've got the income and the subscriptions to really use the services. And that comes down to credit requirements. So a lot of times to get a full access plan, whether that's a cell plan or digital, so say you're buying your online access through like a T-Mobile or a Verizon or something, typically if you want one of those high volume plans, you actually have to sign a contract over a longer period of time and pass a credit check. And that's not always available to everybody. If you're in a prepaid plan, which is something that is available to those who can't sign a contract, who might not have those credits, you actually are paying a higher amount per month at first until you prove that you're paying consistently, and then they'll drop your monthly fees over time after that. But if you ever fall out, you know, they'll bring it back. And then related to that is this idea of paid prioritization. So that's that lower data plan that I talked about. So if you do not have like a high dollar plan that's allowing you unlimited access and you're trying to use the internet, you have a telehealth visit at 1 p.m. when everyone else is doing their Zoom calls, you might not actually be able to use the video, or you might not actually be able to get through in the same way because of the way those systems are designed. If I was to think about it in terms of like a physical space, it would be like, imagine if I-94 was a different width depending on how much you were paying. And that would really impact how far, how fast you could drive. So that's how our wires are working. A lot of the conversation about telehealth and broadband is really about just getting those devices in place and getting those wires in place. But this prioritization system actually has a big influence on how it's experienced with people and how they're able to get online. And then data caps. So if you have a lower cost plan, there's lower limits. I will say, for example, this morning I was actually listening to a health policy podcast on telehealth just to kind of get my head in this space. And all of their sponsors were online services. So like if folks know Mint or Boost Mobile or something like that, and they all advertised, if you listen to them, they would say unlimited service at a consistent amount, $25 a month, whatever it was. And then very quietly at the end after that, they would say, experience will change after you hit 30 gigs or after you hit 40 gigs. That's what this is. It's that data prioritization and those data caps. And when we think about how that's experienced, how online life is experienced, what we found, this is a smartphone example from the engagement that we did in Ramsey County and St. Paul. We asked people, tell us about the type of cell plan that you have. And you see this aggregated or disaggregated, I should say, by race. So the dark green is all respondents, the kind of salmon color is white respondents, and then our BIPOC respondents are in the avocado. On the left, people with contracts and unlimited data. So just under 60% of people, that's the type of cell service that they have. Contracts with limited data, so that's where, again, you're gonna hit that ceiling and you're not gonna be able to use your phone for those telehealth visits in the same way. You know, that's about 20% for many. But then when we look at the prepaid plans, you know, 24% of our BIPOC respondents are on those. So that means you're getting really deprioritized data, and that's going to influence how fast your data works, if that makes sense. So when we were working on this project in Ramsey County and St. Paul, we held what was called the Digital Inclusion Leadership Summit. We brought together about 200 folks like this just to talk about digital inclusion. And we had a couple people with different plans all try to go on the same website and just set the phones on the tables next to each other. And there was a real difference in terms of, for those who are on a prepaid plan, it really can go quite slow and take a lot of data. And so when we think about making things like telehealth accessible to lower income individuals or those who might be on a fixed income and have limited opportunities to get access to those services, there are real consequences in terms of how people are able to experience and access telehealth as a result of that. So wanted to share related to that just a couple stories and examples. in terms of getting people connected. In addition to those cost items that I mentioned, we also heard quite a bit about the importance of adoption and people's interest in telehealth and interest in broadband access. And what we were hearing is that actually more and more people are really interested in getting connected. They're a bit intimidated, maybe at times, by some of the devices. Or they might not be able to make the investments that they need in the type of subscriptions that will really get them the opportunities they're looking for. But I think there's really some hurdles that are being crossed there. These are just a couple quotes to highlight that. But oftentimes it comes back to affording some of it as well. And that kind of connects to why we emphasize staying connected here. So even once you get online, if you get your prepaid system, if you get an unlimited data system, you've got to stay online to stay connected and take full advantage of these opportunities. And I think there's a few things that come into that. There's maintaining your devices, there's maintaining your service, maintaining program eligibility. This is less of an issue now that the Affordable Connectivity Program has gone away. Should it come back, that would be an issue to think about. And then any fees that might result from any lapses in payment. So when we talk about maintaining devices and services, what we're talking about is what it takes to replace or repair broken tablets or outdated phones, outdated computers, anything like that. I don't know if folks have noticed, but since the pandemic, the public health emergency ended last year, we're seeing more and more where telehealth and some of those services are being offered by provider apps that can sometimes be complex. And those will use actually on devices a lot of data. They might sometimes require a higher level of device to fully use. And so when we think about helping people maintain their access to telehealth, maintaining devices at a level that can really keep up with what those apps are asking of them becomes very important. Similarly, if you're in a house with, say you've got just one tablet and that's what you're using to get online and someone drops it, which can happen quite often, you could be out. It could take a while to get something back. The other thing to think about with devices, especially as we get into some of these apps for telehealth providers and things like that, is sometimes you need more than one device in a house to make sure that you maintain your access. So if you have two-party authentication or two-device authentication, if folks follow that, there can be challenges if you lose one of the phones that was the number for your two-party authentication. Or say you had someone come into your home as an older adult, help get you set up on their technology. Did they put the two-party authentication on their number? And now you need to go back for an appointment three months later. Can you get in? You know what I mean? So those are small details that we don't always think about, but if you have really precarious access to digital technology, they make a huge difference in your experience of how you're getting online and how you're able to access those services. Another thing that's really important for some of these is, this is where, I'll talk about it more in a second, but those partners and support services become incredibly important. I'm just gonna watch myself on time because I wanna give us enough time. So in terms of programs, I touched on this earlier, but the Affordable Connectivity Program is something that was lost recently. There are programs actually through providers, so like Comcast has an Internet Essentials program, some might qualify for at an income basis, but maintaining eligibility for those programs can be an important part of staying connected. I had mentioned the story earlier, but we'll reinforce again. I have been struck over the dozens and dozens of people that we've talked to about their experience with digital inequity, how many things they're willing to let go of to keep their cell service or keep their internet service, because it is such a gateway to so many things that they need. And that's becoming even more common as we see, for example, those public services going online as well. And then another part of keeping connected sometimes is tools, and I think this becomes really important for older adults. One of the things we heard in our work was that aging can impact the body in different ways for different people, and it has real consequence for how you get to and experience healthcare. So if you're having any aging experiences that might have lowered your hearing or lowered your vision. Sometimes those online tools, those broadband tools, or I'm sorry, the technology tools and the telehealth can become actually harder to use or harder to relate with. On the other hand, if your challenges might be more of the physical variety, it's hard to walk, you don't have a car, things like that, broadband becomes essential to connecting to resources. And so there are different types of technology add-ons, tools, things that you can use, specialized apps to stay connected, but getting access to those becomes very important. And then finally, this ability to pay for any lapse in fees. So for those who might lose their connection, again, back to how much that was prioritized by those that we talked to, what they said is if they ever lost their connection, the process it takes to get it back can be significant. So that's why they prioritize it. If you're on one of those prepaid plans, what that means is you've probably got a fee and you've got to pay that backed fee and some sort of a charge just to get your phone back. If you're in something called Lifeline, it could be going through a rigmarole of process at the Department of Commerce just to get a new provider. But if there's any gaps in broadband access that sets off just this cascade for people in terms of you could potentially have to change your phone number, your email, whatever it is, and you lose access to so many things. So that's why it becomes important to really know how to use the connection. And what we were hearing from folks on this front is really a few things. Number one is actually comfort with the apps. And I think we're going to see this more and more in the telehealth space, especially if they make telehealth permanently accessible in the metro area or in metro areas kind of writ large. But those apps are very important and very tough to navigate separate from the technology. Comfort with technology, language skills, and then comfort with personal safety. That actually came up as being one of the biggest issues that we were hearing from older adults. So just in terms of comfort with technology, this is just a quick survey in terms of feeling comfortable learning how to use smartphones and computers. You can see overall, about 3/4 of people were saying, yeah, I'm generally comfortable. There's someone in my house who can do it. Far more among our white respondents than our BIPOC respondents, but people feel like they can generally have someone in their house that will help them. But I will say among older adults specifically, what we were hearing is they're most relying on those in-home care providers to help them. Sometimes if they have kids who are in town, they'll have the kids come over and help them, but it's either multi-generational learning or it's those in-home care providers who are helping them learn how to use the technology and get connected. And so this is just a couple examples of that from some of the quotes that we offered. Those in-home services, those social services are really starting to actually even rely on telehealth and broadband to expand their capacity as they get more and more stretched. And so we also heard that from providers as well, where they're starting on the provider side to have say a staff person join a meeting a few minutes early and just help the patient talk through their audio and their visual before the doctor joins and works on the appointment, so that they can really make sure people are understanding the technology and getting connected. And that's getting more and more complex as each provider system is developing its own app that fits with its own systems, et cetera. That technology complexity, I think, could blossom in the future. And then finally, the other thing that really came up as being important for people being comfortable using telehealth and broadband was really personal safety. And so there was a few things that we heard in this topic specifically related to older adults. One, we heard from many providers, here I'm thinking more service providers that supported older adults, that we've spent so many years telling older adults not to click on those links. And now, every time they make a doctor appointment via telehealth, they get those links. And so knowing how to distinguish between what are the apps for a specific provider that we should be clicking on versus what could potentially be a scam is something that people are really struggling with how to even educate older adults on what to expect. let alone conducting that education. It's also becoming a bigger and bigger part of, as I mentioned earlier, those in-home care providers, people who might otherwise provide transportation to doctor's appointments, helping those older adults with their technology, because just getting into those systems can be complex. I mean, I'll even say for myself, I would rate myself highly technically interested, moderately technically capable at best. And you know, during the study, I also tried to do telehealth as much as I could, just to kind of road test every provider that we were talking to. And I had many instances where I would be on with a provider and we could see each other, but we couldn't hear each other, and we gave up and did it over the phone, something along those lines. And it's especially been the case as these new apps are coming online for each provider. So knowing what to connect to becomes really, really important. The other thing we heard a lot from people about was the idea of privacy and safety. And this has less to do probably with telehealth and more to do with the other online uses that people are prioritizing. But they were trying to understand, where do I give my data? Where is it safe to put my social security number into something? Where is it safe to fill out an online form versus where could I potentially be compromising my financial health? What does that look like? And even knowing how to appropriately evaluate some of those websites and some of those links that people were receiving, that became a big point of concern and anxiety for many of the people that we talked to. I would say more so, or especially among the older adult community, but it was common across all those that we spoke to. So when we think about knowing how to use the connection, it's not just about knowing how to get your computer or your phone connected onto an app, or I'm sorry, connected onto an online connection. It's really about navigating those apps and then having the skills and the understanding to know when and how to recognize those links or those tools, those online resources that are safe versus those that are not. And another thing that stood out to us when we think about some of those safety measures and digital inequity comes back to that idea of things like two-factor authentication. So many of the safety features that we rely on to keep our data safe are the same features that can become harder to afford for some people on fixed income or who have limited access to technology. And so there's becoming this growing, just kind of by generosity of their hearts, bridging of that gap, I would argue, in social service providers, in libraries, and some of those spaces. But it remains a delta that has a real impact on how people are able to access things like technology in a sustainable way. So just to kind of reinforce some key ideas, and then I promised I'd leave 10 to 15 for any questions or discussion. Key idea one is just the policy that we talked about. There's a lot of telehealth and broadband policy that really got supercharged at the start of the pandemic, and we've come to take it as being part of our new operating norms. I would argue that our policy frameworks don't see it as the norm yet. It's technically a temporary policy. And so over the next few months, there's going to be a lot of really important decisions about where we keep our telehealth access, what that looks like, and also, how we expand our broadband access. When we think about those things, though, like broadband and telehealth, what we're doing right now on the policy front in terms of really putting more wires in the ground for broadband, giving more opportunities for digital equity is an important first step. But it's really this idea of getting connected and then staying connected and knowing how to use that connection. And that's a really different experience for those who might otherwise face inequities or barriers that I think is really worth acknowledging and worth thinking about. And so I think just kind of a final idea there, broadband and telehealth, they're really making important contributions in terms of expanding our access to telehealth, to healthcare, and to any opportunity. Outside of health and healthcare, online is helping people get jobs, it's get connected to resources. But to really take advantage of that, we do need to get connected, stay connected, know how to use the connection. And many service providers are also starting to rely on it to help expand their capacity. But I think one of the things that we need to think about moving forward is that for those who could be left out of these online opportunities, there are more and more opportunities that they could be left behind in other ways as well. So if we're not able to get online, are we running in danger of not getting access to the service benefits we need? If we're not getting online, are we in danger of not getting access to the healthcare frequency or the places that we need, jobs, services, et cetera? So I think that's one thing that I would just leave you with in terms of consideration is how consequential our online opportunities are becoming, but also how precarious they are for some. So with that, I thank you again for the opportunity to share this work with you and would welcome any questions or things I could elaborate on.
So we have about 10 minutes for any questions for Stephanie, and we have a mic runner over there, and I have a mic here, so if you raise your hand, we'll try to find you. Go ahead.
Thank you so much. That was just awesome. Now, this is going to sound dumb, but what is the difference between broadband and tele? Broadband and telehealth, or whatever it is.
So broadband is the wire.
Sorry, I thought you had a mic.
Oh, sorry. No, that's okay. So broadband is the technology, it's the wire. So broadband is any online connection. Telehealth is healthcare delivered over telephone or broadband. And so they're directly linked, but healthcare is really about seeing your doctor over the computer. Or, I'm sorry, telehealth is really about seeing your doctor over the computer or over the phone. And broadband is really about those tools that make it possible. Do you want me to bring this down? Is that bad?
Hi. Oh, is she?
I'll be your runner.
Oh, so I do have a question. As you talk about seniors, what was the age range? I'm just curious at what point or age people just no longer embrace technology anymore. And I realize that wasn't part of your study, but I was just wondering, anecdotally, did you have a feeling for that?
All right, I think, is this working? So in terms of how we dealt with older adults, there was a couple different studies that dealt with older adults, and those were slightly different. One was 60 and up, one was 65 and up. But I think your question is like kind of at what point do people kind of go, eh. I don't know if I could answer that directly, but what I can say, and I think you even see it in those longitudinal looks at who has technology, is people who are comfortable working with technology at 50, when they become seniors at 65, will be comfortable with technology for telehealth. If you never used it in your working life, maybe less so. It might have more to do with a variety of other things, but yeah, I think that's also, again, where service providers come into it, though. Because you might have a child that's encouraging it, or you might have a provider that's encouraging it, and then some of those in-home service providers are playing this really important connecting role. Because once people can get in, some are open to it. One thing I will say that was in some of the MDH data, it was not a survey we did, but something that is in MDH's report overall, is they asked people about their comfort and trust in healthcare that was delivered via telehealth, and you did see a decline in trust as people got older. So there are some types of services people like via telehealth and some they do not. And that really showed up in our qualitative work too. People really like telehealth for medication management, for pre and post-op, remote patient monitoring. People who are managing chronic diseases, they like it for the convenience factor. For something that feels more unknown, you don't know what the diagnosis is, especially among older adults, they're more trusting in person first and then follow up, if that's helpful.
My question is, broadband, the way I understand it, was used when you didn't have a connection. And so you're using broadband, the word, as Wi-Fi? Okay, and they're not interchangeable because broadband is really something, shortwave radios, TVs that are out in the playground. So I guess I'm not clear on why you're using broadband and Wi-Fi and trying to make them synonymous when there are two different operating systems.
So actually the way I'm using broadband is more the term as it matches with the IIJA law, and what you're talking about there are two things underneath term. So broadband is the umbrella term for online connection at a high enough speed that you can do two-way audio and visual communication, for example. And the way just to get into the weeds for a second, like the way the IIJA defines broadband, they're thinking about moving it from, I think it's 25/3 upload download to 100/20. And so in those instances, there are, for example, cell providers and some of those who are talking about other non-wire or more satellite-based broadband as being an available service. It's not always hardwire. But anything that has those upload-download speeds is considered broadband in terms of the broad use of the term. And online service.
Think of it as a faster, more data can be sent. Yes, it did have a different definition.
It changed the definition.
Is another system, and
Yeah.
that's what I don't want to be confused on.
Sure.
You know, the megahertz and all those other things, yes, that's important.
So technology, I think we can all agree, is changing fast and will continue to do so. And so, yeah, broadband has become that universal umbrella term for all of those components: smartphones, tablets, computers, hardwire, and satellite.
So I just want to quickly simplify this thing. So all of you guys remember the dial-up America Online? That's it. That was not broadband, okay? Whatever you have right now, like through Comcast cable or your fiber connection, AT&T, that's all broadband. Simply think about broadband as a technology that enable internet connection. But dial-up was not broadband. I hope this clears.
That's much better. Thank you. Other questions or comments?
Okay, yep.
Oh, sorry.
Go ahead, Miriam.
Well, first I want to say thank you for the information that you shared, and just to kind of give some context for this question, think of a scenario where we have, say, 25 older adults in the room. We have a captive audience, and we're talking about telehealth, and each telehealth company has their own platform in terms of what they use for virtual conferences and things like that.
Yep.
I'm thinking the approach is to find a way to kind of put it all together that they can understand the concept, and then kind of move from there to what their particular provider uses. That being said, which program do you find to be most compatible or useful in terms of here's the basis for that concept of virtual conferences, whether it's Zoom, Google Meet, WebEx, what have you? Which one would serve a general population best?
I'm going to repeat back your question just to make sure I answer it appropriately and that I answer in my zone of knowledge, since I'm not a day-to-day service provider. So I think one of the things that you're talking about is this real flowering of telehealth. And the thing that fascinates me about telehealth and broadband is that they're both, in many ways, complex private systems. And then you put them together and it just mushrooms, right? And so in telehealth, there's telehealth in terms of how do you get connected with your brick and mortar, an Allina doctor, an Essentia doctor, something like that. And that's going to be the choice of that provider and their IT system. And then there's also specialty clinics who may or may not offer it, and sometimes they'll even have their own apps, is what I've seen in like the big brick and mortars. And then you also have these other telehealth apps that might actually literally be like an app on your phone, and like you press a button and connect to a doctor for a specific service. And those are just mushrooming. The complexity of that, I think, is beyond something I would be able to speak to directly, but I do know each one of them has their own technology requirements as well. It's determined by so many factors.
So unfortunately, we are out of time for more questions. We have the next session starting in here in about 10 minutes on privacy and online security. And then next door, we'll have a session on that vocabulary that I talked about and learning the language. So how about a final round of applause for Stephanie?